Hi there, good afternoon. I'm Brandy Smith, digital anchor for KHOU 11 in the KHOU 11 newsroom. We are standing by waiting to hear from Fort Bend County Judge KP George offering a media update about COVID-19 in Fort Bend County. This comes a day after we heard from Harris County Judge Lina Hidalgo. She raised the COVID-19 threat level in Harris County from yellow to orange. The primary reason is because of the spread of the Delta variant of COVID-19. A lot more contagious. We have seen case counts jump. The Texas Medical Center reports that hospitalizations are increasing and that most of those who are being hospitalized and those whose deaths are attributed to COVID-19 are largely unvaccinated, near 99%. I want to pull up a shot here so you can see as we wait for Judge KP George to take the podium there. We're expecting an update on vaccination distribution, efforts to increase vaccine access for at-risk communities, the impact of COVID-19 variants in the county, and recommended precautions being taken to reduce the risk of COVID-19. Yesterday, you heard from Judge Lina Hidalgo and from Dr. Peter Hotez of Baylor College of Medicine an encouragement for folks who are vaccinated or not to begin wearing masks again because of the spread of this Delta variant. Another variant, the Lambda variant, has also been detected in Harris County. We shared some of the numbers with you yesterday. Hospitalizations, a month ago, hospitalizations due to COVID-19 in the Texas Medical Center were around 50 a day. Now they're hovering around 100. And that number, it's going in the wrong direction. We made significant progress as folks started to take precautions, mask up, social distance, stay home when they could. Then we had the vaccinations roll out. And that brought case counts down, but now the Delta variant is spreading throughout our community. Wastewater sampling throughout Harris County has shown where that variant is popping up, where the virus is. We've also seen breakthrough cases for folks who are vaccinated, who have tested positive for COVID-19, who have had symptoms of the virus. And one of the things we're tracking now that we're more than a year into the pandemic are some of the long-term impacts of COVID-19, what they call the long-haul symptoms, one of those being brain fog. Researchers in the UK and folks at UT Health, doctors at UT Health, backed up that study, saying that those affected by COVID-19 have shown atrophy in the parts of the brain that affect taste, smell, and memory. And so that's what they attribute that brain fog to, that long-lasting impact. And at this point, we don't know how long those effects will last for some folks. So again, if you are just joining us, we're waiting on Judge KP George of Fort Bend County to provide an update on COVID-19 response in Fort Bend County, one of the highest vaccinated counties, if not the highest, in Texas. I was just reviewing numbers, working on a story for our 4 p.m. newscast about how we determine vaccination rates, because there are several different factors that you can consider. When you're looking at vaccination, are you looking at those who are fully vaccinated or who are partially vaccinated? I'll explain more after we hear from Judge KP George.
Please come up. And also, where's Tammy? Tammy? Can you do something with this mic? This is low. Bring it a little bit lower. And go back. Yeah, go back. Yeah, then
That's
yeah,
good?
yeah, that's good. That's good.
Okay, good. Okay. Thank you.
So we are ready? Thank you for being here. Good afternoon. I am KP George, Fort Bend County Judge. Today, we are here to give you an update on our efforts in Fort Bend County to assure that our residents are informed of the most recent information surrounding the increase in COVID-19 cases in our county. And as you know, it is throughout the country happening. The effort that we, the people you see behind me, and are putting in place to make sure that Fort Bend County residents continue to have access to COVID-19 vaccine so they can protect themselves, their families, neighbors from contracting this dangerous virus. And it is important that I have joined by today, the people behind me, especially our Health and Human Services Director, Dr. Jacqueline Minter, Tony Sharp. Tony here? No. Oh, Tony's not joined. J.T. Pena, Brian Petrella, Scott. Scott is here? Okay. And of course, Ben is not here either, right? Ben? Okay. And of course, Alan from our Office of Emergency Management, and others to discuss what we are doing in Fort Bend County. Because as you know, from day one in Fort Bend County, we relied on science, data, and also experts to make sure we are doing everything possibly to combat this dangerous enemy of maybe of the century. And that's the reason why we were able to, when it comes to testing in the beginning, we were able to test maximum people. We are still in the top 5 or so. And then when it comes to vaccine administration, we are really took that seriously. We did take that seriously. The people behind me, as a team, we all work together. And that is the reason why we are so far doing exceptionally well when it comes to vaccine. And 65 and up age population, 96% in Fort Bend County have at least one vaccine, and 88% is fully vaccinated. I believe that is a great accomplishment. And 12 and up, 74% got at least one vaccine, and 66% of Fort Bend County is fully vaccinated. And so now, as you all know, we wanted to protect our citizens from, especially from this new variant transmitting virus, especially to those who are not vaccinated. And we talked the details. Obviously, we are joined by numerous experts, in their field. And I just wanted to invite, Fort Bend County Health and Human Services Director, Dr. Jacqueline Minter, to give an update on our status, COVID-19 status in Fort Bend County. Dr. Minter?
Thank you, Judge George. And good afternoon, everyone. Exactly 1 month ago, this week, actually today, we received confirmation of the presence of the Delta variant of SARS-CoV-2 virus in Fort Bend County. We received laboratory results for 5 residents who tested in prior weeks. We completed those investigations and announced the confirmations within 24 hours of notification. Along with that announcement, we reminded our residents that the Delta variant was present in the community before this confirmation. Obviously, it had to have been because they tested before. Because of the knowledge of the Delta variant's effect in other countries across the globe, we could anticipate the effect it might have on our community. This provided us with a wonderful opportunity to underscore the importance of getting vaccinated and remembering that both doses are needed when receiving the Pfizer or Moderna vaccines, and the importance of wearing masks and maintaining physical distance from others when you're in public spaces for those who aren't fully vaccinated. Well, since that announcement, we've been able to further quantify the results of the Delta variant, increasing in viral activity with increased test positivity, increasing cases, increasing hospitalizations, and that includes ICU admissions. And of the variant cases reported to the Fort Bend County Health Department this week, or in the past week, 77% were of the Delta lineage. The vast majority of the severe illnesses have been in unvaccinated people. We are finding that this variant is especially adept at spreading in close groups of unvaccinated people. And although it appears that our vaccines are holding up very well, while transmission rates are low, as the transmission rates increase, especially with this contagious variant, new data will learn whether they still hold up or whether they might not be quite as protective with the higher transmission rates. Our community has benefited from a population willing to be vaccinated and provide protection for themselves and others. However, we've got to consider our neighbors and children for whom vaccination is not an option. We also have friends and family that have health conditions that don't allow them to receive the full protection even when they are vaccinated. Wearing face coverings when we are unable to maintain safe spaces will help prevent the spread of this highly contagious variant. Clearly, we're not free from the effects of this virus. As new data is provided, we will inform the community as early as possible so people can make decisions and take steps to protect themselves. And in the coming months, as I've said before, we're likely to see fluctuations in cases as new variants emerge. The characteristics of these variants, how fast they spread, what populations they affect, and how well our vaccines will work against them will determine future actions that we have to take to protect ourselves. In the meantime, wearing our masks and remembering the easy-to-follow steps of physical distancing and washing our hands will help us maintain the collective health and well-being of our community.
Thank you. Thank you, Dr. Minter. COVID vaccine continue to be our best bet to the way out of this pandemic, and we still have many in our communities not protected with this vaccine. A rapid spread of Delta variant is putting entire community in jeopardy. We have to take action now to slow rapid spread of Delta variant. It is twice as contagious as original COVID-19 vaccine, as you all know. And masking has been proven to significantly reduce the spread of COVID-19, to help protect yourself and other residents, your neighbors, your family, should be vigilant you have to be vigilant and wear mask indoors. And that's why, it is proven, and it is, there is no need to fight these mask and vaccine and things of that nature. And when you are with people other than your family members, please wear mask. And it is highly recommended wearing mask while you are indoor, asking everyone to wear a mask indoor when in county facilities. This is a preventative action that is being asked. This is not, I will repeat, this is not a mandate, but it is strongly advised to reduce the number of infected people. To talk more about this, I will invite our county's risk management and loss control and safety specialist, J.T. Pena.
Good afternoon. Just like the judge says, we just want to reiterate for everybody to protect themselves. There's going to be seeing signs go up throughout the county for our patrons and our employees, where the mask is going to be recommended indoors to protect yourself, your family, and the people around you and your neighbors. Just like the judge says, we just want everybody to protect themselves to the best of their abilities and give them the tools and the reminders that they need. Thank you.
Thank you, JT. And I just wanted to let people know that last week I went to visit my 89-year-old mom, and I didn't see her for 2 years. And I wanted to visit a lot of family. Originally, I am from New York, and so I wasn't able to visit our family members, other family members, because a number of people are sick with COVID Delta variant, and they are vaccinated. And the beautiful thing about that infection, beautiful thing about that is they're okay, and because they're vaccinated and they're okay. And also, I just read yesterday, Texas Tribune reported since February, Texas lost around 8,787 Texans we lost to COVID-19. Out of that, 43 people, only 43 people were vaccinated. Rest, all of them. That gives you more than 99.5% of the people we lost was not vaccinated. Please, people, and vaccine is here, and vaccine is going to protect you. Please get vaccinated, and this has continued to be a problem all over the country. And the fact is, here we know the fact, and the science is available. COVID is not gone. And we all wanted to get back to normal, and we are almost back to normal. And we wanted to keep it that way. That's why we are taking these precautionary measures so that we could keep Fort Bend County continue to thrive. And as you all know, I mean, when it comes to one of the success, most of our businesses getting back to normal, and people are getting back to their regaining some of the normalcy in their life simply because we were able to vaccinate the maximum number of people. But when you have around 860,000 people, and even 25-30% of the people, it's a lot of people out there. And so my request to our residents, please go and get vaccinated if you are not vaccinated. And if you are vaccinated, tell your story and tell your neighbor, your family member, those who don't want to get vaccinated or vaccine hesitancy or things of that nature. Tell them so that we have an understanding and we can spread that good word so that we could save lives. And so we all know it. It is, and we all know that. We talk about the community protection, or we call it herd immunity, and we are still not there. And so let's all work together. And so I wanted to also bring up, I will bring back Dr. Minter to talk about the preparation and how the vaccine situation, the vaccine locations and the preparation, how we are making sure everyone who wanted to get vaccinated, there is no more registration, there is no more waiting, and you could walk in and get vaccinated, and as you all know, it is a free vaccination. Dr. Minter, can you give some information about how our vaccine locations are operating and what people need to know about it?
Sure.
Please.
Thank you. So yes, thank you, Judge George. Our vaccine locations continue to be open. We're open Wednesday through Saturday at our fixed locations. We're open from 11 to 7, so that gives people who are working some time to get off work and come and get vaccines. We also have multiple locations with our mobile unit. Every Saturday, Sunday, and Monday, our mobile unit is in different places in different precincts throughout the county. And then by request, we are doing different community organizations, homeowners organizations, working with nonprofits at times and places that are convenient to the public.
Thank you, Dr. Minter, and we will continue to work together with our community leaders, of course, these people you see me behind me, and our community partners, nonprofit religious organization. We worked very closely with our religious organization, our religious entities to, get into the community more and just spread. When we wanted to send information, we worked with them very closely. We will continue to do that. And other municipal leaders, elected officials, this is not a one-person or two-person effort, and we will continue to work with these stakeholders to combat this dangerous virus. And also, I just wanted to say, we have seen a spike in numbers when it comes to young adults getting infected from COVID-19 vaccine. And also we need, I repeat this, if you are vaccinated, tell your story to others, put them at ease so that they will go get vaccinated, provide information, and and that's the reason, that's one thing I will say, and also we all know that the vaccines are safe, effective, and life-saving. And as far as county's standpoint is concerned, definitely we will continue to do this effort, and we are actually working with certain organizations to find out and learn and understand about the vaccine hesitancy. And we are here to learn. We are here to learn. And we have noticed the people of color, economically disadvantaged, and things, people of that nature, they are the one always get left behind. And we wanted to reach out to them. We wanted to provide them with information so that they could make their decision what is best for them. And we wanted to make sure they get the information. And that's what we are trying to do. Remember, protect yourself, protect your family, protect your neighbor. Stay safe. Get vaccinated. For time being, wear your mask. Thank you. If you have any question at this point, we could entertain some questions.
So you mentioned Fort Bend County's vaccination rate of 66% for people 12 and over. That's much higher than the surrounding counties in the area. What do you attribute to that very high number here compared to other places?
Because we took from day one COVID as a serious matter. And we invested so much time, so much our resources, and like everyone you see behind me contributed to make that happen. And we mentioned about our nonprofit organizations, and every stakeholder we can talk to, we can communicate and coordinate, and we worked with everybody. And so, as you know, when you're trying to reach out to 860,000 people, and it is definitely it takes a village. And so we went with maybe a village, and that's the reason why we are where we are today. And at the and along with that, we will continue to do this effort because we don't want to slow down because COVID is here, COVID Delta variants and other definitions of COVID are here. So we will continue that effort. That's why we brought all this, our leaders, and we will be communicating with our community leaders also. And the end result is we were able to get a high percentage in Fort Bend County.
One brief follow-up.
With the mask, with the county so vaccinated, why are you asking residents who are vaccinated to wear masks indoors? I mean, if they are protected from the Delta variant, what is the reasoning for doing so, and why should they wear masks indoors? Because
one thing I will give more scientific. Would you please go ahead and answer that? I could answer it, but you could put it in the eloquent way, scientific way. Please go ahead.
Sure. That's a great question, and a lot of people are asking that same question right now. So what we've said is that if you are fully vaccinated, you are protected from the virus in general. Right now, what we're noticing is that because the Delta variant is so widespread through the community, it'll take time to see if, with more numbers of people that are infected, if that vaccine, is able to hold. That's just we don't know that yet. And we also know that there's a segment of the population that will not be able to be vaccinated. Vaccines are not 100%. So there's still a percentage of people that won't be protected even if they take that vaccine. It's a small percentage, but it's still a percentage, and a bigger number means more people.
But it seems like, again, when people went the effort, this county and their community took the effort to get vaccinated, to get back to work, to not to wear the mask, and it seems like this is almost like again, oh, here we go again, wearing masks again, even though I'm vaccinated and protected. What do you try to assure those people to say that this is just for the good of the community?
It absolutely is the good of our neighbors and our friends and those who are not fully protected. There are people that will not get vaccinated, aren't able to be vaccinated, and we all have our children. Our children are not able to be vaccinated right now. Now, they may not have some of the same effects, but then they can still spread and potentially spread to someone who's older and may not be able to be protected.
And Dr. Minter, I wanted to add there, and I mentioned I was in New York a few days ago, and one of my cousin's husband got sick. He is vaccinated. He is vaccinated. And so I don't think when it comes to Delta variants and all, you have protection, but you're not fully protected. And he got sick, and he's showing symptoms, but thankfully it is just like a flu. And we know that he's going to be okay. And so wearing a mask is a simple thing we could do to protect ourselves, because this is a proof of Delta variants doesn't care you have. But probably if he was wearing mask, maybe he wouldn't have to go through that problem. But my point is, there is always wearing a mask is one of the best practices for everybody, for us, people around us, our community, and so I believe we have a moral obligation to support that process.
We had another question.
Yeah.
George, just to follow up, you had mentioned a couple times the importance of telling your story, right, to overcome that hesitancy and to get people to want to take the vaccine. As you know, Fort Bend County is so diverse. There are so many people here who have family members all over the world, including in countries that have been hit very hard by the Delta variant, low access to vaccines. India is just one that comes to mind. Do you think that's a factor in getting people to really kind of like take this really seriously and maybe hits home a little bit more and get vaccinated?
Yeah. I tell you this. I talk to some of my relatives. I have friends in India. And I tell you this. They ask me, you mean to say you all are vaccinated? Those people are still standing in line to get their vaccine. And so we don't have, we just mentioned in the beginning, there is no line. And you just walk in and get, and what is the worst case can happen. And so absolutely it is important. But at the same time, I understand human beings, if they have any hesitancy, they have any issue with this. And that's why we wanted to provide them with information so that they could make their decision what is best for them. Thank you.
Thank you, Judge. I have another question. I was just wondering how the demand for vaccines has changed in the past couple of months. Has it slowed down in the county? And then secondly, in terms of the outreach that you mentioned and informing residents about the vaccine, who specifically are you kind of trying to reach, and then in what areas and in what ways are you informing people?
So first of all, like I said, we wanted to learn what is the need, first of all, and then can you repeat the first question?
Has the demand slowed for the vaccine?
Yeah, definitely. The more people get vaccinated, because as you know, we had at least 4 or 5 permanent locations. Then we have a mobile unit, and we are going to so many different places. There is a definite slowdown because a lot of people are already vaccinated. So definitely there is a slowdown. And talking about the outreach, it is simply to provide information. It is simply to provide information. And Dr. Minter, you wanted to elaborate what that exactly means, because there are some concerns out there, about the outreach. So would you clarify that? So thank you.
And I do want to just mention, when you had the question about demand, and the judge is absolutely right. A lot of people have vaccine already. But what we do notice is that when we go into targeted communities, there's a demand there. There are specific churches that we'll go to. If a priest, say, gives a call out and we're there on a Sunday during Mass, we can have 80, 90, 100 people that said, oh, I'm so glad you're here. Very glad you're here because I work early in the morning till very late at night. I don't shop at H-E-B. I don't shop at Walmart or places where you can get a vaccine easily. They may shop at the Dollar General and they don't have a pharmacy. They don't have regular care. So it's a different type of demand that certainly hasn't decreased. So I want to point that out as well. And outreach, of course, is going to be in those areas where people are not receiving vaccine. We're determining those areas. It's pretty easy to determine those areas just by looking at the numbers. We have health data analysts, and we partner with School of Public Health, and we are able to see locations of low vaccine rates and low vaccine uptake. And also, we can overlay those by areas where we've had a big impact from COVID disease. And so those are the areas where we can reach out to community leaders. We can find out the ways people want to be communicated with. And once we determine the ways they want to be communicated with, maybe our message will get there better and faster, and we'll be able to at least give them the right information to make the choices they want to make about their health.
Dr. Minner, just one more question. Because this county has been so vaccinated so much and is almost at a herd immunity, do you think that this period of wearing masks indoors and all these other procedures that you're doing, would that be a shorter amount of time than you think, depending on the vaccine, how many people more take the vaccine and how the Delta variant adds?
We certainly hope so. What we've seen throughout this pandemic is that our behavior affects the outcomes. Our behavior affects the outcomes. Our behavior affects the outcomes. And so we've watched, and we know there's a 10 to 21 day lag between the time that we see the results of our behavior. And so I hope that that is the case. Thank you.
Thank you so much. We appreciate you
Yeah.
coming out
Thank
today.
you.
Thank you.
Thank you for being here. Appreciate it. Appreciate it.
All right, you just heard from Judge KP George with Fort Bend County, as well as a number of experts about the county's response to COVID-19 and the threat of the Delta variant, a very big concern for folks in Fort Bend County as well as Harris County. That is why our COVID-19 threat level increased yesterday from yellow to orange. I want to go back over a couple of points that they made to get you caught up in case you joined us in the middle of that briefing. Judge George said that positivity, cases, hospitalizations, and ICU admissions are all up in the past couple of weeks in Fort Bend County. 77% of those cases have come back as the Delta variant, and most of the folks who are ending up in the hospital are unvaccinated. That's why he, as well as the doctor you heard from there, asked people to start wearing masks again, to return to the habit of wearing masks indoors. It is not a mandate. Governor Abbott issued an executive order in May that prevents counties from enforcing mask mandates or stay-at-home orders. So this is just something that Judge George says he strongly advises. Perhaps you heard a familiar voice in there asking questions as well. That was our own Adam Bennett. He is going to be working on stories for 4, 5, and 6, but his reports begin at 4 o'clock this afternoon if you want to tune in there. Had a lot of great questions in there. The judge said his staff is going to start putting up signs around the county reminding folks to wear masks, reminding them why they need to wear masks. He says everybody wants to get back to normal, which is why we lessened some of the COVID response when case counts were going down, but now that they're going back up, that it is a personal responsibility to take care of ourselves and our families, our neighbors, by masking up. That point that the doctor hit home repeatedly there at the end, our behavior affects the outcome. Judge George encourages folks, if you haven't gotten vaccinated, to go get vaccinated. And for those of you who are vaccinated, to share your story, to let your family know, to let your neighbors know, anyone who might be hesitant about getting the vaccine, to let them know what your experience has been. I'll share, I'm vaccinated, my significant other is vaccinated, and my children who are 14 and 15 are also vaccinated. My significant other's children are fully vaccinated as well. I want to go back to something we were discussing before Judge George came to the podium, and that was how we talk about vaccination rates. Because you heard Judge George boasting that Fort Bend County has a really high vaccination rate. 65.9% of Fort Bend County is fully vaccinated compared to 53.86% in Harris County. So a significant amount. But how is that calculated? And you can see different numbers sometimes for different areas, and that can be confusing. So the factors that we're looking at, there's vaccinated and fully vaccinated. There's also unvaccinated. But vaccinated usually is referring to the one shot. That means if you started the process of getting Pfizer or Moderna, you only got one of the 2-shot vaccine. Fully vaccinated indicates that you got the Johnson & Johnson shot, one-shot deal, or got both of your Moderna or Pfizer vaccines. And again, Unvaccinated means not vaccinated, no shots. The next component is looking at the population. So how many people are fully vaccinated, and what is the population base you're using to calculate that? So if you look at Texas, for example, there are 29 million Texans. So you could take that number of fully vaccinated Texans and compare it with that. You're going to get a lower number than if you compare it to the number of Texans who are 12 and older. Those are the only folks who can get the vaccine. Only 12 and up is eligible. So it's not really a fair calculation to add anyone who's 11 and younger into that equation. Here at KHOU, that's the number we're talking about when we say the percentage of fully vaccinated. It's the fully vaccinated of those who are eligible. I want to pull up Facebook really fast and see if we have any comments here, any questions that I might be able to answer. Bear with me a moment. Oh, I just saw a question about what about those of us who have had COVID? This brings up a really interesting, some research that just came out at the end of June, looking at how antibodies last. So if you got COVID, they last for a good amount of time. But if you had the virus and then you also get one of the mRNA vaccines, that's Pfizer or Moderna, your immunity to the virus could last years versus the Johnson & Johnson shot formulated differently, and it looks like that's the one that will likely need a booster shot first as we move along. But again, the trials were only started about a year ago, so we're still waiting to see how long those vaccine antibodies last in the trial participants. That's why every so often you're going to hear, do we need them every 6 months? Well, the vaccines lasted 6 months. So now we're approaching a year. Do the antibodies last for a full year? Marco asked about vaxxed people who are still catching it. The doctor touched on this. The vaccine is not a cure. It is not 100% immunity, but it is an added layer of protection to prevent severe symptoms. However, we have seen some deaths in folks who are vaccinated, but when you look at the numbers, I think the last ones I saw were in May, 99.2% of COVID-19 deaths in May were unvaccinated. There was a small percentage who did get the vaccine, but it gives you an idea. Judge George also brought up, sorry, looking through my notes here. He mentioned that 99.5% of deaths in Texas have been unvaccinated. So that really gives you an indication of the effectiveness of the vaccine. Sorry, this just updated. Let me see. Sherry asks, I took the Pfizer vaccine in March. Will I need a booster? Right now, the trials do not indicate that within a year you would need a booster, but we're still watching those trial participants to see how long the antibodies last. Stephen is questioning my notes. Y'all can read them. This is what I was noting as we were going through. I don't know if you can decipher them. But do you like Adam Bennett in large? I wanted to make sure I mentioned him because he asked some great questions throughout that press conference. Yeah, Mary said, I had COVID and still got the vaccine because you can catch it again. Can you guys still hear me? You can still hear me. But it looks like, hold on, I'm going to try to flag down Jaime. I think Cam 29 just died. Yeah, I can still, y'all can still hear me, but you just can't see me. Okay, we're going to iron out these technical difficulties, but thank you for joining us. Until next time, have a wonderful afternoon.